Okay, doc, I need to know what exactly is prostate cancer?
Well, prostate cancer is the uncontrolled growth of cells from the prostate. And the prostate is a walnut sized organ that is underneath the bladder. So when men get older, the prostate actually enlarges, but sometimes those cells can grow uncontrollably and actually form cancer.
Interesting. Now, who is most at risk for prostate cancer?
Well, there are several groups that are at higher risk for developing prostate cancer. That can include African American men and men with a family history. So, if a brother or a dad or an uncle has prostate cancer, that patient would be at an even higher risk. And lastly, there are some groups, such as Ashkenazi Jews, that may be at even higher risk for prostate cancer.
Now, I'm curious, doc, are there prevention steps that people can take?
Well, the first thing is to exercise, eat well, lots of fruits and vegetables. Moreover, we encourage people to do screening such that if they are unfortunate enough to have a prostate cancer diagnosed, it is captured early.
Now, I need to know what are the warning signs or symptoms that we should be on the lookout for?
Well, that's the tricky part. Sometimes there are no warning signs. But if a gentleman knows that it's harder to urinate, he needs to urinate more frequently, is unable to sleep through the night, or notices blood in the urine, those are all warning signs that should prompt a visit to the doctor.
Now, who should be screened for prostate cancer?
Well, that's a very, very interesting question. There's been a lot of back and forth on that. But now, many groups realize that men in the age of 50 to about 75 are at risk and should have the discussion about screening for prostate cancer. Some groups are at higher risk, and they should have that conversation even earlier between the ages of 40 and 45. But once again, it's a discussion between the patient and their doctor.
Now, once you start getting screened, is it something you should consider having regularly done?
Well, yes, and it really is based on the results from the test. If the test results are very, very low, men may go every 2 years for their screening. However, if a number is somewhat high, but not quite high enough to be alarmed, they may have testing more frequently, perhaps once a year.
Now, you talk about the testing. Now, what are the methods for screening for prostate cancer?
Well, many people think that the test for prostate cancer is uncomfortable, but we now start with a simple blood test, and that allows one to detect prostate specific antigen or PSA. Higher levels can make us suspicious for the diagnosis of prostate cancer. Other methods for diagnosis and testing are more involved, but they're only done if necessary.
Now, what typically happens, doc, after someone is diagnosed with prostate cancer?
Well, the first thing that we try and tell people is that after diagnosis, to not panic. There are multiple treatment options. And so they may visit with a urologist who does surgical procedures on the prostate, and they may also meet with team members such as the radiation oncologist who can use radiation to treat, or even a medical oncologist who uses different medicines to help treat prostate cancer patients.
Now, doc, describe the treatment options for someone diagnosed with prostate cancer.
Well, that really depends on the stage of their diagnosis. If someone has a single spot in their prostate, they may be a candidate for surgical resection. If someone has disease that's more involved and involves even lymph nodes, they may need combination approaches such as radiation and hormone therapy. Unfortunately, some men present with advanced disease, and medical oncologists use things such as hormonal therapies, chemotherapy, immunotherapy to treat those patients.
Okay, doc, I need to know, how bad is it? Like, what are prostate cancer survival rates?
Well, what we try to tell people is that no one likes the word cancer and no one likes that diagnosis. However, if caught early, survival rates approach 99%. So we tell patients not to panic, meet with your care team, and see what needs to be done.
Hey, doc, this has been great. I can't thank you enough. I appreciate it. Thank you.
No problem. Anytime, Grant.
All right.